Thank you very much, Regina. Good morning, everybody. And it's my great pleasure to be with you this morning to open the All-Ireland Institute of Hospice and Palliative Care Research Network's 6th annual symposium. And my thanks goes to Dr. Regina McQuillan, Chair of the Institute and Medical Director, for inviting me to join you at this event, and indeed for all your work in putting together an event like this. I know a lot of work goes into arriving at this point. I also wish to acknowledge Professor David Clarke, who will speak to you later on the subject of best practice for interdisciplinary research in palliative care to inform policy. And Professor Clarke is a Professor of Medical Sociology at the University of Glasgow's School of Interdisciplinary Studies, where he leads the Glasgow End of Life Studies Group. So thank you very much, Professor Clarke. And I'd like to extend a special welcome to the researchers and the clinicians from academic institutions, hospices and palliative care providers, people with palliative care needs and their family carers, and representatives from health agencies and funding organisations who are focused on developing palliative care research that informs and improves policy, practice and education. It's great to have you all here with us today. Today's event, as we've already said, has been organised by the All-Ireland Institute of Hospice and Palliative Care, an all-Ireland consortium of hospices, hospitals and universities, all of which are working to improve the experience of palliative and end-of-life care on the entire island of Ireland. The ultimate aim is to ensure that high-quality palliative care is provided to all who need it, and your institute plays a valuable role in palliative care education, research, and ensuring, very importantly, that the voice of people with palliative care needs and their carers is heard also. This institute is an example of how, by working together and sharing resources on this island, we can deliver evidence-based palliative care research that ensures inclusivity and accountability for people with life-limiting conditions and their families. And I am conscious that I'm speaking this morning at an event of an all-Ireland institution. I'm conscious that we're having this conversation in the context of many discussions that are taking place across the water in the United Kingdom and in Brussels in relation to Brexit. And indeed, I would have met some of you here in this room at a recent all-Ireland civic dialogue I held on health in County Louth a couple of weeks ago. And what I want to say to you, arising from that dialogue, it is very, very clear that Brexit or no Brexit, institutes like this and relationships that have been created north and south, east and west, everyone's absolutely determined that we put in place mechanisms to continue that collaboration. And whilst there are so many known unknowns in relation to Brexit, and indeed so many moving parts, and that's likely to be the way for quite a period of time, I am encouraged as Health Minister that those very deep personal relationships and professional relationships that have been built up over many, many years, north and south and between Britain and Ireland, in the health sector are very, very strong. And the willingness and enthusiasm of everybody to keep them going and to work out new and innovative ways of keeping it going if needs be should be a source of encouragement, if not irritation that it has to happen, but a source of encouragement for us all. It is, as everyone in this room knows, it is one of the great success stories of our age that so many people are now living for so much longer. But this means that there will also inevitably be increased numbers of people living in the community with chronic diseases and with life-limiting illness. I think this year we'll have seen about 25,000 more people in our country over the age of 65 than last year, and over 3,000 more people over the age of 80 this year than last year. So each and every year, thankfully, people are living longer. But that obviously does present new policy challenges that we need to grapple with in terms of how we meet people's healthcare needs right through the full spectrum of life. We need to plan to ensure that the palliative and end of care needs of our population are met. And in the future, it's absolutely clear and unambiguous that we will need to provide more and better palliative care services in more settings to more people. We want to ensure that all people will be provided with the type of palliative care services that they need, regardless of what diagnosis they have, how old they are, or whether they die in a hospice, an acute hospital, a nursing home, or in their own home. The HSE's National Service Plan for this year identified access to palliative care, integrated palliative care structures, and quality improvements in palliative care services as its key priorities for the year. The palliative care budget in this country for this year is 76.5 million, which does not obviously include expenditure on specialist palliative care provided in acute hospital, palliative care support beds and designated home care packages. Much of the funding is, as many of you in this room know, channeled through service level agreements with voluntary hospitals and with home care providers. All our HSE areas now have community specialist palliative home care teams, and these teams play a vital role in enabling people to die at home. Specialist palliative daycare is now provided in 7 locations. The number of hospice beds in Ireland has increased significantly in recent years, though there's an awful lot more to do, with the capital being secured through a partnership approach with the voluntary sector. Once the 15 inpatient beds at Kerry Hospice are opened at the end of this year, we will have 223 specialist palliative care beds in 11 locations countrywide. We have achieved much in a short number of years, but there's absolutely no room for complacency. Many challenges remain, particularly the need to ensure geographical equity of access to specialist palliative care. Several areas of the country have no inpatient unit, but we do have plans to address this. New hospices are now planned for Waterford, for Wicklow, Mayo, Drogheda, Cavan and the Midlands. In November next month, we will publish a palliative care services 3-year development framework for adult palliative care services, covering the period to the end of 2019. The framework charts a path towards full implementation of the recommendations in the 2001 National Policy Report. The framework is ambitious, and the pace of implementation obviously is subject to discussions I'm having with my colleagues in advance of next week's budget. My department is considering next steps in relation to how the framework might inform an update of the current national policy. In 2009 in this country, we published a national policy to provide strategic direction for children's palliative care in Ireland. The policy emphasised supporting families and healthcare professionals to provide care for children in their own homes with centre-based supports where needed. Arising from the recommendations in this policy, a programme of care for children with life-limiting conditions was established in the HSE with co-funding from the Irish Hospice Foundation, which I wish to acknowledge and thank them for. The programme included the appointment of the first paediatric consultant with a specialist interest in palliative care. 8 children's outreach nurses were also appointed to ensure that children can continue to be cared for at home by their families and have access to coordinated and supportive services. Last November, I had the pleasure of launching an evaluation of the Children's Palliative Care Programme, whose recommendations included the appointment of a second consultant as well as additional outreach nurses. We now have 2 new outreach nurses appointed and a third due to be appointed very shortly. The Irish Hospice Foundation have also agreed to fund the recommended second consultant post for 1 year, after which the HSE will fund it, and I again thank them for that. Other key recommendations in the evaluation, including around respite and bereavement, will also now be addressed progressively. We have another area that's receiving, and rightly receiving, increased attention in recent years, and that's the palliative care needs of people with dementia. We know that because of a greater number of older people in our population, the number of people living with dementia is projected to treble in less than 30 years. My department has published a national dementia strategy, which recognises the vital role played by GPs and their teams and emphasises the importance of palliative awareness for all those who deal with people with dementia. The successful development of palliative care services in Ireland has been based on a long-standing tradition of positive engagement between the voluntary and the statutory sector. Organisations such as this institute have played a vital role in this work, both by initiating programmes and also by collaborating with the Health Service Executive in a very positive way on a range of fronts to strengthen the provision of palliative care. I think the conversation that you're having today and bringing people together from across this island and bringing outside speakers is so important as we launch our next 3-year development plan to make sure that we provide geographic equity of access to people with palliative care, to make sure that we continue to develop palliative care services for children, and that children should be able to move between the hospital setting and the community setting in a very seamless way. And there's been good progress in that, but much more to do, to make sure that we can care for the additionally complex needs of people requiring palliative care who may have conditions such as dementia, and to make sure as a country, and I'd suggest globally, we grapple with how we make sure people in an ageing population right throughout the world can die with dignity, with cares, and that we can meet the full spectrum of their needs in whatever the most appropriate setting is. So I think it's an exciting time to be discussing these areas. We are back in an area of reinvestment in health. We have an awful lot to do after a lost decade of investment in public services in this jurisdiction. But being able to make those reinvestments based on sound policy is what's absolutely crucial if we're not to repeat the mistakes of the past. And I've no doubt that this institute will help contribute to the development of that sound policy. I wish you very well with your deliberations. Thank you very much.